Hi everybody, welcome to this session. A few familiar faces in the room as well as Roy Lilly, so no pressure at all. My name's Kelly Angus and I'm Head of HR Services and Development for Northumbria Healthcare NHS Foundation Trust, and I'm joined by
Gary Charles, and I'm part of the workforce planning team in Northumbria.
Okay, the HR QlikView project has been somewhat of a challenge, I think it's fair to say, but we've certainly embraced technology in the broadest way that you possibly can. So I'm going to tell you a little bit about the organisation. We've got approximately 9,000 substantive staff. We cover a wide geographical area from the banks of the Tyne up to the Scottish borders and over to the west. We provide acute and community care in North Tyneside, which is a small suburb, about 200,000 people. And we provide acute, community and social care for the whole population of Northumberland. So it's quite vast, some rural, some urban, and obviously a number of cities there as well. We are currently in the process of acquiring Northumbria Hospital's NHS Trust, and that will happen on the 1st of October. So our substantive staff will move to approximately 13,500 to 14,500, and geographically we'll cover the whole of the north of England. So no pressure there for the size of the organisation. Northumbria has been a foundation trust since 2006. We are regularly highly rated by Monitor, something we're very proud of. The organisation came together as one following transforming community services, where we had 3,000 staff in community, 6,000 in acute, and obviously we've merged into what is now the foundation trust itself. We have a turnover and annual budget of approximately £470 million, although with cost improvements and everything else, although that sounds a lot of money, efficiency is a really big driver. We have a very low labour turnover. Our communities aren't very transient. We tend to have people who come and work for our organisation and stay for a long time. And that's certainly one of the things that has influenced some of this project. And one of the things we've also done is introduce the patient experience at the bedside, 2 minutes of your time. So we ask individuals who are patients, we ask them, have you got 2 minutes? Can you just tell us about your care? What's that been like? And we actually feed that back to the staff on the ward within 48 hours, which is quite unusual, because if anybody knows, you fill in a survey and sometimes you pop it in the box and you're not quite sure when. The staff certainly get that feedback, and it's published and available for patients to see as well. These are our trust values, and I think that's something we're very proud of and something that the organisation aims to operate by. Patients first is our first one, and staff absolutely agreed that that should be our first value. Safe and high quality care, a lot in the press at the moment, and also about safety. It's certainly one of the things that drives our organisation. Responsibility and accountability. Everyone's contribution counts, and in our HR team we've got approximately 100 staff, and everybody has participated in this project, although Gary has done most of the work. Everybody's contributing. I couldn't, certainly for my team from HR, everybody's contribution has counted. Respect, I think that says what it does, and I think we're all absolutely one of the key things. We have 3 main sites. We have North Tyneside General Hospital, Wansbeck General Hospital and Hexham General Hospital. To give you an idea of the geography, North Tyneside to Wansbeck's about 15 miles, North Tyneside to Hexham's just under 30 miles. So we cover quite a geographical area, and to Berwick is about 70 miles. So it's a huge geographical area. We've got approximately 40 community bases, and we've got many shared or joint teams with social care, independent, voluntary sector, and they're spread about all over. And obviously we have a wide range of services. This is something very different. We are developing a Northumbria Specialist Emergency Care Hospital. We'll be one of the first in the country. It will be where all blue lights go. It's central to that geographic area, and we will be asking staff to work differently. We need workforce information at our fingertips, and we need to be able to remotely provide information to our staff and managers on workforce issues. This is a geographical area that we cover. We've got currently on the 3 main sites outpatients, diagnostics, day cases, elective surgery, subacute inpatients, acute inpatients, A&E emergency admissions and minor injuries. What we're aiming to do is focus those 3 major sites into one emergency site, so that we'll move all what we call classes hot diagnostics into one area. But our base sites will continue to be community-facing hubs and continue to deliver a lot of elective care and also certainly a lot of outpatient care. So we're still going to have big workforce teams on each of those sites. So really we're moving from 3 to 4. This is the lovely glossy brochure, which we're really hoping our new hospital looks like this, but it's something, it is state of the art, it is very different. When the HR services which I manage came together about 18 months ago, we were very paper driven. Other than NHS jobs, everything that we had was paper driven. Historically, staff hadn't been used to using technology, so I think it's been fair to say that this has been somewhat of a journey.
I'm just going to take you on a journey basically of how we've been getting on with QlikView this far. As Kelly explained, we've been on a journey for around about 18 months now. And just to start it off, we're starting with a quote from Demon, who is a quality guru, who I'm sure I don't have to explain about you. But it's "In God we trust, and all of us must bring data." And I think that's very relevant, our project at the moment. Even if you look at stuff like the Francis report out now, if you bother to decipher the 4,000 pages, or cheated like me and looked at Roy's blog this morning, you'll see that data is very relevant, particularly valid data, which is used in the right way by the right people. And this is what this project tries to bring. The rationale around the QlikView project, we talk about the transforming community services, really this was the main rationale. I was part of a team from Northumbria Primary Care Trust, who vertically integrated with Northumbria Healthcare. And with that, as part of the treaty arrangements, come QlikView. And this is very, in terms of embracing technology, I think this is where we did really hit the brief. We could have left it there and it could have sat, it was just a system, QlikView was just a platform. We could have left it there and sat and done nothing, but we've decided to try and do something a little bit different with it, and with our HR department, and hopefully that'll span towards the rest of the trust. And so I had that, and also I had at the time the Quality and Excellence, Lansley's Liberate the NHS along with Sequin, and we've all got our cost improvement programs. And so quality data and take releasing time for our managers, so they're not coming back and forth, our training teams, workforce teams. So ward managers on spending a lot more time than they need to, looking at our reports where they could be given that time, releasing that time back into the patient care, which is essentially what it's all about. So they were the requirements of the trust, and I think I've already touched a bit on the quality aspect of that. Data, you can do anything with data, but it's quality data and validated data which we're looking at here, and that's where we're getting to. We're on a journey, and we're about 95%, we're nearly there at the minute with that data, as I'll explain with some of the project work we've been doing. And the big one in terms of lean is the standardisation element of it. We had lots of pockets of different people reporting on different elements, different people reporting on the same elements at times, and we've been able to standardise that through some lean working, through some process mapping, through some standard operating procedures, and looked at that standardisation of work all together. The aims of the project at the beginning were to develop easy to read dashboards, firstly in the instance in HR, and within HR we developed one for recruitment, for learning development or training, and for TAeR. And TAeR's time attendance and e-rostering. If anyone's got the smart system, it's the hand reader, pop your hand in and take the reader. And off that data you can look at ward rostering, European Working Time Directive, and that's the sort of stuff we're trying to report on at the moment. We want to incorporate the workforce KPI set by the organisation. Like our board, we've got a workforce committee, and they're very keen on statutory mandatory requirements from CQC, NHSLA, and requirements of the workforce in terms of age profile, retirement portfolio, absence, turnover, all the essential workforce KPIs, if you like. And again, we needed evidence in the dashboards, which I think we've done. Ensure the dashboards standardised and freely accessible. And by that, I mean it's not just sitting with senior managers. So I speak about ward managers before. We want them to have access to these dashboards, again, so that they have the cool face, and so they know where they are. And so we're not sending them a report on a monthly basis and they're questioning it and taking time out of that patient experience, if you like. And finally, which is a byproduct, if you like, it's the reducing time and costs spent on workforce reporting. So we wanted to reduce the time, and with that has come efficiency savings. You'll see on the stand outside, we're looking at about 300,000 plus, and they're very conservative figures. It's not about the cost, but it is a byproduct, and it does help with sequencing our cost improvement programme. So to deliver the project, we had a presentation early on about the Northumbria Way methodology. The methodology we developed around about 18 months ago, and I suppose the QlikView project's been being the prototype, if you like, we've been the dummy run for that. And so we followed that methodology, and that's very much in line with the lean culture and thinking. With it, we developed a project team from HR being the core of that team, but we've also got the key people from, we've got key people from learning and development, so those who knew about the data, recruitment, and the time attendance in the rostering team. And all of them reported back to their individual business units, whether it be surgical business unit, medical business unit, to their managers, to them OSMs and general managers within those business units. So we could get feedback, so we've developed the dashboards in line with what our staff want. So it's been a bottom-up approach, it hasn't been dictated from us. And finally, we realised quite early on that we put our hands up, we didn't really have the SQL SQL skills to develop the dashboards and how we wanted, so we collaboratively worked with some local developers in our area, based in Heaven, not far from us, and we've worked with them to come up with the dashboards, which I'll run through now. So the story so far, we've got the recruitment dashboard, which is in full use, and it's used on both an operational and reporting tool. The top left-hand picture there is an operating picture, if you like. Our recruitment team use it on a day-to-day basis. Before they had a clumpy Excel spreadsheet which broke a lot, something which we're still trying to get rid of. It's still there, but we're trying to get rid of. It took, if someone was on the phone and they said, where's Mrs. X in the process, then it took quite a long time to find Mrs. X. This way you just type in the search bar and it's there, it's very quick and it's standardised, everyone's doing it. And because some of the results of that we've managed to increase productivity within the team, our lead time has reduced dramatically. We were on almost 26 weeks from start of recruitment process to end of recruitment process. We've now got that down to this week from the KPIs there to 40 days, so we're looking at 8 weeks. So that's happening. The turnover rate within recruitment wasn't very good. There was a constant turnover. I know Kelly touched on turnover of the whole organisation is low, but turnover in recruitment was really high, which obviously has an impact on the recruitment process, and so on and so forth. We've managed to reduce that quite dramatically, and with that, the absence rate, we're just over the 20% mark absence rate, as well as high turnover. Now it's something at 4.5% when we last checked, prior to coming here. And finally, that dashboard you see at the bottom, we're now very transparent, and that is reported from an HR point of view in our workforce committee. We've also developed a learning development dashboard, and with it, what I was on about before, we developed some standards and some SOPs around that. What we quickly found when within this project, when we went to learning development, was if I was taught how to input information in the electronic staff record, ESR, by Mrs. A, I would be taught completely different by Mrs. B. And so what we had, we didn't have any standardisation. People were, well, good pockets of work, but people were doing as they pleased, if you like. All trying to do it for the right reasons and in their own little way. No one was deliberately telling someone else to do it different, but it was very different, which was causing problems with the data, big problems. Different people were reporting from different systems. With this, we managed to, and one of the things QlikView does, it pulls data from ESR, from Excel, from any other place where you point it to. So we've managed to pull all that data together and get dashboards like this. And again, like the recruitment one, it's the increased productivity has led to efficiency gains. And finally, the TAeR one, which is a little bit more behind. It's not as fully operational as the other two, but we're nearly there with it. And with the TAeR one, we're focused on hours worked, hours owed, rostering, and the European Working Time Directive. We're currently going through a data cleanse sense check with Smart, who developed the TAeR system at the moment. Because again, as I'm talking about data, we feel there's a slight issue with that data validity, so we're looking at that as we speak. But what we have found is the data what's come out is a lot further on than where we were 6 months ago. So just to summarise up the QlikView project, what it's done for us, it's increased the quality and data of our reporting, increased productivity, we're spending less time on reporting, which means we can spend more time on the coalface and doing other things. That's essential, that one there, the released resources allow more time to care. It just shows, or we believe it shows from an HR point of view, changing stuff within HR, you can actually affect what's happening out there in the hospitals and in the trust. And again, as I've touched on, the efficiency gains. cost improvements. So what the future looks like for us, we will continue to improve these dashboards again. I mean, no apology for it, no excuse for it. I think I said throughout this process, we're about 95% there, we're not there, and we'll probably never get to where we want to be. We'll always be learning. But we're looking to roll out, continue to improve the dashboards we currently do, and then roll out to all that HR areas. We've already developed one currently in the before workforce data. We're looking at medical devices, HR productivity, by that grievances, disciplinaries, and health and wellbeing dashboard. And finally, what we're looking to do is share it amongst the rest of the trust. I think with this QlikView system, there's a chance to get a 360-degree sort of holistic view from the organisation. It shouldn't just be used for HR, it can be used for sequence targets, for monitor, a whole organisational view, if you like. And again, share with other trusts like yourself. It's working for us, so I'm sure it could work for others. And I think that's it. Thank you.